Thank you very much for the opportunity to participate in this very innovative interaction or conference. My topic today is clinical effectiveness of azithromycin in treatment of early syphilis. It's a meta-analysis. I'm a PhD student. By way of introduction, I want to introduce what is syphilis. Syphilis is one of the oldest known or frequently encountered sexually transmitted infection and is caused by a bacteria called Treponema pallidum. So this infection, despite availability of very cheap and effective therapy, the incidence is increasing in many parts of the world, especially in developing countries and among gay men and other men who have sex with men. In spite of penicillin's proven usefulness for syphilis therapy, because over the past decades, penicillin has been used for treatment of these syphilitic infections. But physicians and other healthcare who manage people with this STI frequently ask for alternative for treatment of penicillin because of the possible side effect or allergy to this penicillin. Allergy to penicillin is well known by most healthcare workers. And recent studies have shown that azithromycin, which is in a tablet form as a single dose, oral dose, as an antibiotic, can be potentially appealing alternative for early syphilis treatment, especially in people who have allergy to penicillins. Azithromycin as an antimicrobial agent with broad-spectrum antibiotic has become a mainstay for treatment of sexually transmitted infection and has been used successfully as a single therapy for many number of patients with syphilis. Research by many authors in this area have shown this azithromycin to be effective, and many randomized controlled trials have relatively proven azithromycin to be effective in treatment of early syphilis, especially in preventing transmission. So the main objective of this research is, of this meta-analysis, is to systematically evaluate the clinical effectiveness of this azithromycin in treatment of patients with confirmed diagnosis of early syphilis in clinical setting. What is the global burden of this syphilis? The prevalence and incidence of syphilis appear to be increasing worldwide, particularly in developing countries, mostly in sub-Saharan Africa. And the incidence varies from population, with overall reported substantial rise in cases of syphilis over the last decade by health authorities around the world. So wide ranges of antibiotics are used to treat this infection, depending on the availability and so depending on other conditions such as allergic status of the patient, because if a patient has allergy to penicillin, you can use penicillins to treat him even if you have syphilis, and also the stage of the disease. Penicillin on its own appears to be the most frequently used antibiotic in syphilitic therapy, and however, penicillin is not without its shortcomings. What are the shortcomings in developing countries where syphilis is common? There is issue with the storage. We don't have storage facility in most of the health facilities where they keep this penicillin. They can't keep it within a recommended temperature of storage. And they also have skills to, some health facilities in the rural areas lack skills to deliver safe injection. So that's why it's also another shortcoming of penicillin. But a substantial quantity of literature has been published on the effectiveness of azithromycin in treatment of early syphilis, and they have demonstrated that it is clinically efficacious when compared with other antibiotics, especially in penicillin-based treatment utilized in many years ago. Because for over many decades, penicillin has been the drug of choice for treatment of early syphilis. But because of this shortcoming, many literature have shown this azithromycin to be effective. So what is the problem? As I've mentioned earlier, this syphilis is one of the most frequently encountered sexually transmitted diseases in STI clinic in both developed and developing countries. Syphilis infection is far more dangerous than the outcome of disease in an individual because syphilis is connected to infection of the sexual cord. Because if you have syphilis, if you have a sexual encounter with other people, you can easily infect your partner, and you can now create a ecological corridor for further transmission of the infection. With an amplified threat of acquiring, because of the syphilitic ulcer on the genital tract, you have an amplified threat of acquiring immunodeficiency virus infection, HIV, making it an important public health problem by contributing significantly to the transmission or to transmission to sexually transmitted disease morbidity and mortality around the world. So what method did I employ in order to look at why I think azithromycin is clinically effective in treatment of early syphilis? This is a review or a meta-analysis that uses secondary data from published randomized controlled trials available online. Initially, what I did is to conduct a scoping electronic search using, I break down the question into a PICO model. What are the population people with syphilis? What is the intervention? The intervention is either syphilis or any other antibiotic used in treatment of syphilis. Then the comparator, the intervention is, my intervention is azithromycin. The comparator is penicillins or other antibiotics. Then the outcome is the cure. We compare cure as a result of use of intervention or the comparator to identify, and also after breaking down the question into PICO, the search also is to identify terms used by other researchers. So based on the PICO model, the research question was broken down into components in order to ease search by using the thesaurus and the synonyms. Search filters was joined with the aid of Boolean logic and or not in the search in the electronic database search. All the database search were limited to those studies published in English because of timing. I don't have time to translate some of the publications that I may be able to see during the search. And studies using human as a subject, these are the only studies we consider. And the population of interest in this study I have mentioned is the patient with confirmed diagnosis of early syphilis in clinical settings. The intervention is azithromycin used in treatment of early syphilis. The comparator is placebo or any other antibiotics used in treatment of syphilis. What are the study type? The studies are only studies that are randomized controlled trial with comparative with comparison group. So data from these RCTs that met the inclusion and exclusion criteria were analyzed with a review manager software of the Concrete library. Then forest plots from the Redmond software would display the result of various studies as square centered on the point of estimation. And the result of the individual studies, the chi-square, p-value, degree of freedom, and confidence interval were used to explain my result obtained from the forest plots. So what are the results? After the scoping search, a total of 172 references with possible relevance to this review were identified. But when I did a title and abstract sifting, I identified 39 potential relevant papers. But the retrieved articles were screened using a Prisma flow, which identified which article is relevant based on my criteria. Therefore, full text of these articles were retrieved and assessed for relevance after duplicate publication, because of different journals will publish about 2 or 3 articles which are the same. Studies were identified for review after fulfilling the review inclusion and exclusion criteria. So this is the data extraction from the eligible trials. After subjecting the 35 using the Prisma flow, the 35 studies identified, only 3 randomized control trials were able to satisfy the inclusion and exclusion criteria. This one is by Cook, the third et al. In 2012. He compared azithromycin with penicillin. In this study, he was able to get volunteers and he followed them up to the period of 12 months. And the follow-up was quarterly at the 3 month, at 6 month, at 9 month, and at 12 months. So in the penicillin group, people with confirmed diagnosis of syphilis, he was able to out of the 17 people that was only 15 were followed up. So if you can look through the data, because of time I cannot go through the data. This is the data. The second presentation, the second study that certify the review, what is coming up? Okay. The second study that certified the inclusion and exclusion criteria was conducted by Redna and colleagues in 2005, and another study was also conducted by Hook together with his colleagues in 2010, and this is a multi-center randomized control trial, but he was only able to follow up patients up to 6 months. Then this is from the results. When I enter the data into the review manager, and this is the forest plots. Forest plot is a display of the contribution of each and every study into the meta-analysis. You can see the Cook and et al. Study, randomized control trial conducted in 2012, contributed only 1.1% weight in the review. That is, when we compare meta-analysis, the cure rate, meta-analysis cure rate at 3-month follow-up, that is azithromycin versus penicillin G. Another research by the Hook and et al. In 2010 contributed 54.8%, and Redna and colleagues in 2005 contributed 41%. So this is the effect. The odd ratio using the fixed model shows that this diamond shape is showing the effect, is showing the odds that patients that receive azithromycin are favored. This is the line of effect. So it is more in favor of azithromycin after 2 months. But it's not showing. I have pictures here, but they are not showing. I don't know why. Meta-analysis was carried at 6 months. Okay, then the meta-analysis of the 3 studies are shown above. The pooled result for proportion of participants would decrease RPR. RPR is the rapid plasma reagent. So this rapid plasma reagent is what you measure from the blood of the patient that received treatment. And when it is decreasing, when the volume is decreasing by 2 dilutions, it means that the cure rate has been achieved, and it is used as a yardstick for measurement of recovery from the disease. And it has revealed that the proportion of subjects was slightly in favor of azithromycin, as I have highlighted in the forest plot, than the penicillin G 2.4 milli-national unit at 3-month follow-up, although not statistically significant as shown by the p-value of 0.81%. But at 95% confidence, the result will always be between 0.76 to 1.5. Similar final result is statistically significant, but is in favor of azithromycin. While at 6 and 12-month follow-up, 2 studies reported results with no statistical significance difference. The weighted odd ratio 1.8, and at 95% confidence, the result will always be around 0.52 to 6.2 and is statistically significant. So the pooled estimate from this analysis shows an odd ratio of 2.0, and since the odd ratio is greater than 1, this indicates that there is increased odds that the azithromycin group will experience. I'm talking about now the side effect than the control penicillin G. So these are the references I use. Then in conclusion, the meta-analysis of the 3 randomized control trials shows that a single dose of azithromycin to be as effective as penicillin G for achieving serological cure rate, that is decreasing reagent plasma protein titer when compared to initial results before enrollment into the study. Findings are not statistically significant but unlikely to be clinically important. However, the findings may be implausibly clinically significant because at the 3 months we can see that the azithromycin group have increased odds of recovery from the disease when we compare with penicillin G. But when subsequently at 6 months, 9 months, and 12 months, it is more in favor of penicillin G, though not statistically significant. The evidence may not be clinically significant, so further clinical and multicenter trial may be required to justify or refute this finding. So additional clinical trials in many regions of the world between diverse racial sets to guarantee extensive satisfactoriness of the azithromycin in treatment of early syphilis is also needed. The future trials are supposed to be prepared to match up with the local or national early syphilis management guidelines. I think thank you for listening.